Hello, I'm Locke Meredith with Legal Lines, and I'd like to invite you to join me on the next show. I'm going to have Dr. Bill Cassidy. He's running for the Louisiana Senate, District 16, formerly held by Jay Darden. He's going to talk to us about a free clinic that he has, free dental care that he has, immunization programs that he's instituted, and why he wants to run for District 16 to help our health care system. So join us on the next Legal Lines with Dr. Bill Cassidy. Welcome to Legal Lines. I'm Locke Meredith, and I'm very pleased to have on the show today Dr. Bill Cassidy. He is running for District 16, Jay Darden's old Senate seat here in Louisiana. Doctor, thank you for being on the show.
Thanks for having me.
First of all, tell the folks a little bit about yourself. Let's talk about your educational background.
I went to Terra High School way back when, went to LSU Med School, and after living in Los Angeles and continuing my training, my wife and I moved back about 16 years ago.
Now, she's a doctor also, as I understand.
She is. She recently retired. Her practice was the treatment of breast cancer. Mine is the treatment of liver disease. I've been teaching with LSU Med School for the last 16 years, working primarily out at Earl K. Long Hospital.
And so basically, I assume that's pretty much in terms of professional occupation, what you've been doing is private practice and teaching, or was it primarily teaching?
No, 1 day a week I have private practice, 2 or 3 days a week I teach, and then 1 day a week I do research in public health.
Tell the folks why you decided to run for this Senate seat.
You know, our state is an incredibly blessed state. And when I look at our state, I see the absence of, sometimes at least, the vision and leadership. And Locke, if you look at the programs I've done in the community, not in an official government position, but just as someone who can work with others and form coalitions, I think I've done some good stuff.
Well, let's tell the folks about that, because it is impressive what you've done. And it wasn't because you were running for anything or you were getting compensated for it. You were just doing this because you saw the need, and you really coordinated a lot of big activities. Explain to the folks your involvement in the Katrina problem.
Yes, well, it started off when Chancellor Jenkins of the LSU system sent out an email saying they needed doctors and nurses at the PMAC and the field house.
This is when folks were being shipped in from New Orleans who were traumatized and in bad shape.
Correct. So I went out there and volunteered for a couple days, and then they realized that the potential for evacuees to come to Baton Rouge was much greater than the field house and PMAC could control. And so they asked me to help set up an old abandoned Kmart on North Airline into a field hospital. So we started, I think we opened the door on, I think, Thursday at 4 p.m., and we were ready to take patients Friday night at 10 p.m.
How did you make that happen?
Well, first, I will be quick to say, man, it just wasn't me. There was an incredible number of volunteers. Churches would send out 50 and 100 people to just sweep the dirty place out. Folks would go to Home Depot, and Home Depot, just on the idea that they would get paid from FEMA, donated all sorts of stuff that were able to kind of partition it off. Nurses and physicians from across the country, lawyers, engineers, folks just came and helped, and it just happened.
So you saw, I guess, the community come together, and frankly, you were in a position of leadership, not one you necessarily espoused to, that you wanted to have, but you got put there and it worked.
I didn't mind having it. I loved it. But again, I will stress that it worked because the folks that came and helped made it happen. And I truly think that's the way our state will improve, that we have leadership that can coalition and work with others, taking the talents of our people and just pushing them, or if you will, directing them towards solving the problems our state has.
Well, and I noticed that it must be very unusual what happened, because I know that some national publication, I think Money Magazine and a couple other folks actually did stories about it because it was so unusual.
Yeah, it was, but again, it's just one of the most you hate to say in the midst of a disaster you had a great experience, but just seeing Baton Rouge come together to serve other people was truly an incredible experience to be part of.
Well, let's talk about some of the other stuff that you've done independent of Katrina, and before Katrina was going on. You were doing things to help the general public and population. What were you doing?
Well, one thing we did is we set up a clinic for the working uninsured. These are our neighbors who, for whatever reason, can't afford health insurance, but they're working full-time and earn too much.
Well, I can tell you why they can't. It's so expensive. It's unbelievable.
It is expensive. And one person in a small business would get breast cancer, for example, and because her costs were so high, everyone loses their insurance.
Right.
Now, a dentist named Glenn Kidder came when I was the president of the Medical Society. We collaborated. We decided to come up with what we call the virtual clinic. And in the virtual clinic, If somebody is working full-time, doesn't have insurance, they come, they screen, they qualify, they're referred to the dentist or physician who treats them for free, and then they can go to the hospital, get their blood work and x-rays for free. If they need surgery, they come out to Earl K. Long, bypassing the emergency room, get placed straight into surgery clinic, have their surgery.
Really?
The record goes back. We worked with the Bar Association. The plaintiffs' bar said, listen, you guys are doing this for the right reasons. You were not, unless it's, as long as you're providing the free service, the plaintiffs' bar has signed off on a bill in the legislature saying that your guys are free from liability unless it's egregious. And so there's a real collaboration.
Meaning the doctor's doing the free work.
Exactly.
Right. Saying plaintiff lawyers aren't going to mess with a doctor who's providing free services.
And so there's so even folks who oftentimes don't see eye to eye saw eye to eye on the need to help our community.
Wow, that's very interesting. So you have a bunch of professionals
We have
willing
400 dentists and physicians
to put out their services for free because they saw the need and they knew they were treating folks who were trying the very best to
Yes.
provide for themselves but were incapable.
And the example I use is the attorneys doing pro bono law work. This is the physician's pro bono, if you will, but it also is a network. So if I see a patient and he needs to see a renal doctor, he goes to see the kidney doctor and then can see the cardiologist. It's truly like an insurance network.
Still going on?
Absolutely. We're now 5 or 6 years. People come from elsewhere to see how we do it to take our model back to their towns.
Extraordinary. I understand you've been involved also in immunizations.
Yeah,
Explain that to the folks.
I'm a big believer that if we're going to decrease healthcare costs, we have to decrease the disease that contributes to it. So when we looked at why children weren't being vaccinated for hepatitis B, adolescents, teenagers, as it turns out part of the problem is that moms have to work.
Explain hepatitis B. I'm not sure everybody really understands what this disease is and how you contract it, etc.
Hepatitis is a germ that infects your liver. In the case of hepatitis B, it's spread by blood and body secretions. So physicians, nurses are at risk because if we have contact with a patient's blood and that person's infected with hepatitis B, then we are infected. Mamas can give it to their babies when the baby is born. As it passes through the birth canal, the mama's secretions can infect the child if the mama is infected. And so the point is...
What are the symptoms of it?
Well, the worst symptoms is where your eyes turn yellow and you become terribly jaundiced. A liver fails, people become confused. If it becomes chronic and they get cirrhosis, they can vomit blood or their belly can swell with fluid.
Okay, so serious stuff.
Serious stuff.
And you instituted this free immunization process.
Yeah, I had a girl, 18 years old, and she came and she was going to die. And we shipped her off in the middle of the night for a liver transplant, and I was so discouraged because I thought, here is a girl about to have a $300,000 liver transplant with lifetime medical cost over $1 million, and we could have prevented this with a $50 vaccine. And so I woke up in the morning so discouraged, and I said, by golly, we're going to do something about it. So a friend of mine was working in a school clinic. I called her up. We brought the program to Westdale Middle School. We did about 600 kids that first year, and then we decided to start expanding. Finally, we ended up going to 134 schools in 10 parishes, vaccinated 36,000 children over 6 years.
Still going on?
No, we stopped because the kids vaccinated at birth have reached the age where we were vaccinating.
Great. This is Locke Meredith with Legal Lines, and Dr. Bill Cassidy will be right back. Welcome back to Legal Lines. I'm Locke Meredith. Again, very pleased to have on the show today Dr. Bill Cassidy. He's running for District 16 for the Louisiana State Senate, formerly held by Jay Darden. Again, Doctor, thanks for being on the show.
Thank you, Locke.
It's so interesting, all the stuff you're talking about, that you've kind of spearheaded to provide health care free of charge to a lot of folks who need it. Mm-hmm. You were talking about the clinic, the dental clinic and the medical clinic that helps working folks who are uninsured. Tell folks how they can get in contact with that
Call
facility.
769-3377. 769-3377. That is the office, and they will be referred to the screening site. We have screening sites in Ascension Parish, East Baton Rouge Parish, and I think we finally opened one in Livingston. And so they can go to the one in their community.
And what is the screening process? Do the folks need to bring certain indica of income or employment, or what do they got to do so they don't show up wasting everybody's time and theirs?
When they call, they'll be told what to bring, but basically they need to bring proof of employment employment and income for the previous year. Because this is not welfare. This is one part of the community helping the other part, which is trying to work and make it happen. And so if they bring their W-2 form or check stubs from work or anything to show that they've worked at least 48 out of the last 52 weeks, at least 30 hours a week.
And that's the criteria?
That's the criteria.
Again, give that to the folks?
They have to work at least 48 out of the last 52 weeks, at least 30 hours a week, and earn less than 200% of federal poverty level. That varies depending upon the number of people in a family.
Do you have an idea of what the range is?
No, I'm afraid I don't.
Okay. And once they are screened and once they're plugged into the system, they have available, it sounded like to me, all kinds of health care.
They really do. They really do. And so
dental, medical,
hospital, not hospitalization, but laboratory and x-ray services. And again, it's a public-private partnership, so folks can plug in or will get plugged into Earl K. Long if they need surgery or something else, which is more expensive than...
Now, what about doctors and other health care providers that want to plug into this great program? What do they do?
They can call that number. We've had tremendous support from the dentists and physicians. Again, 400 different dentists and physicians are donating time, many of them donating money. And so we've had tremendous support from them, but if they want to get in touch with us, they can either call me personally or they can call the clinic and we would arrange an orientation for their staff.
Excellent. We were talking about the immunization programs you'd been involved in, vaccinating over 36,000 kids for hepatitis B.
Yes.
Also, as I understand it, you've been involved in obtaining immunizations for the flu, influenza.
Yeah.
Explain that.
Well, the Centers for Disease Control recognizes that many people who are uninsured go to emergency rooms to get their health care. So they need their diabetes medicine, they don't have insurance, they don't have money, they go to the emergency room. So they called us because they knew of our work with immunization.
When you say they called you, the hospitals called you?
No. There's some folks at the Centers for Disease Control.
Gotcha.
And asked if we wanted to collaborate. And so we put in a program where the last 4 years we've been in area hospital emergency rooms vaccinating folks as they come in.
Interesting.
Yeah, we've had tremendous response, tremendous success, and we hope to we've already published several papers, but we'll publish some more in the near future.
And I assume the hospitals love it because it frees up their resources.
The hospitals do like it, and the fact is that every case of flu in someone that you prevent with the vaccine is one less person admitted to the hospital. One more life that is potentially saved. One more person who doesn't spread it to the older person whom they live with at home. And so it can have a tremendous public health benefit.
Let's talk about why you're running for the Senate. Why?
I think I can make a difference. I think when we voted for term limits 12 years ago, what we were really saying is that we wanted non-politicians to run for political office. We said the old model where you first are this and then you're that and finally you're this is broken, doesn't work, we don't like the way our state's going. What we want is real experience of people in life. You have an experience which is far different from many of the folks down at the legislature. Other folks who's trying to get their children good public school education or again, as a physician, trying to get health care for the uninsured. That's the experience that we need. And frankly, I think that anybody who's not a politician should consider running for public office because of term limits. Now, when I looked at my resume, looked at the things I had done, I said, well, there's nobody in the legislature that does what I do. There's no one that has the ideas I have. It's my civic responsibility to run. It's worked out well with my family life. That's most important to me. With the support of my wife and children, we've decided to make a go for it.
So I assume with your background, because you do have a unique credentials and set of experiences, what would be your focuses? I assume it's going to be with the health care, because frankly, our nation, and particularly our state, we're in a huge health care crisis.
Health care is broken. It is broken, and those folks who need it the most often are the ones who can least get it. And so one of the things I would do is attempt to work on that. But also as a teacher. I've been teaching medical students for the last 16 years. If your doctor's less than 40 years old, they were probably taught by me at some point in their career, if they went to LSU New Orleans Med School.
What do you see as being the way to solve the charity hospital system? Because I'm reading recently where the LSU Board of Regents is telling LSU, hey, bug out of that thing. We don't even want to mess with the charity system. I've had Jay Darden in here where Jay's saying the charity hospital's got to be torn down. Something's got to be done. It's going to cost millions and millions of dollars. What do you see as the problem, and how do we fix it?
I truly think this is where my expertise, unique experience will play well at the legislature. One, I can tell you that the charity hospital system is overwhelmed.
Because you work there. I mean, you run the show there a lot of times.
Well, I don't run the show, but for the last 16 years I've been trying to make it run. And I can tell you that the current model we have does not work.
What are the problems with it right now?
An inadequate facility with not enough capacity. So there may be a 10-month waiting list for some needed preventive health care intervention. Our clinics are overflowing. Our hospital is almost below code.
So the staff and the building and the facilities
is
just
staff is
overwhelmed. Huh?
It's overwhelmed. The staff is great trying to make it work, but there's inadequate staff. We have beds that we don't have open because we don't have enough nurses, for example. So what I would propose...
So it's broke.
It's broke.
It's as broke as it gets.
We need to do what other communities do, other states do, which is have a university teaching hospital which complements the private sector but does not compete with the private sector.
Explain that.
There's no reason that we have to have a hospital that has a PET scanner. A PET scanner costs millions of dollars. We can rent that service from the Lady of the Lake. I don't think we have to have our own cath lab or where you go for cardiac catheterization. We can rent that space from Baton Rouge General. There's no reason for us to deliver babies if we can put our OBGYN program in Women's Hospital, where they're delivering 9,000 children a year. On the other hand, if we put our residents in those hospitals, their Medicare reimbursement goes up substantially. Now, those are new dollars. Those are dollars we're leaving on the table that places like New York capitalize on.
You've lost me because I don't understand how this system works. So you're saying by creating a teaching hospital and creating residents, they can then work in these hospitals that do have these facilities and be entitled to collect more money from the federal government for the services they provide?
Exactly. You have your public-private partnerships where your doctors in training also train at private hospitals, which increases their reimbursement, more dollars for more health care.
All right, let's talk about that on the next segment in the educational side of this. Okay. This is Locke Meredith, Legal Lines, and Dr. Bill Cassidy. We'll be right back. Welcome back to Legal Lines. I'm Locke Meredith, and again, very pleased to have on the show Dr. Bill Cassidy. He's running for Jay Darden's Senate seat, District 16. Again, Doctor, thank you for coming in.
Thank you, Locke.
Very interesting talking about the charity hospital system. Clearly it's broke. What we're doing isn't working. We're just subsisting, maybe. Your proposal is very interesting. How are the other hospitals dealing with this concept of bringing in a research hospital or a training hospital?
The other hospitals have bought into it so far because, again, the idea is to have a public-private partnership. Right now we have a silo. We have a silo where we do teaching, and we have a silo where we do private patients. If you integrate those, if you break it down and make them cooperate, then everybody has more dollars to provide more health care, and you can actually more appropriately deal with some of our medical issues.
It's interesting because we had talked about how, in essence, having the teaching hospital with producing residents to then go help the other private hospitals enables the private hospitals to be receiving compensation from the federal government. They should like that.
Yes.
Now, how does this benefit just me?
Oh, man.
You know, the guy that pays $10,000 or $15,000 a year in health care insurance, like everybody else.
The point I want to make is that this is a business and middle class issue.
How?
When folks go to the hospital and don't have insurance, somebody pays for it. The hospital transfers those costs to the small business person, to the middle class person trying to purchase an individual policy. Your premiums have gone up at least 20% because of what is called cost shifting. Now again, it's complicated. But
I was going to say, explain that to me.
Well, if they're providing $10,000 worth of free medical services to somebody, then somebody else is paying. And it's typically the people paying for private health care.
It's sure not the hospital eating it.
Well, the hospital can't eat it. They would go out of business.
Right.
And so it's going to be the small businessman like you, the small businesswoman down the street, who sees her premiums going up every year, even though no one has been sick. Someone has been sick. It's the cost that's been shifted to them from the sick uninsured.
And what's happened is the small business owner, a lot of them, can't afford it anymore.
Absolutely.
So as a benefit to their employees, they say, guys, you're doing a great job, but I can't pay your hospitalization anymore. And now we're to the folks who we were talking about in the very beginning segment, who are hard-working people but don't have insurance because their employer can't provide it.
Absolutely. You go back to the reason I'm running. For 16 years I've tried to make it work for folks who don't have health insurance, and I truly have not seen solutions to this middle-class healthcare crisis coming out of the legislature. I hope to help provide those solutions.
What other solutions do you envision? Because we're talking about a huge segment of our society, millions and millions of folks who were probably insured 5 or 10 years ago, but because of the increasing costs can't do it. What are we going to do?
There is no way that we can ever control healthcare costs unless we first decrease the burden of disease. That's why I'm into immunizations. By immunizing people with the flu vaccine, the hepatitis B vaccine, again, the girl that goes for the $300,000 liver transplant, it could have been prevented with a $50 vaccine.
So hit it before it ever starts.
Boom, you got it.
Okay. What's the other side of the equation? I know that we talked before the show that there's other focus areas of health, just the general health of folks. You want to promote that. How?
Well, we need to, I like to use the example. We don't want our children to be hurt when they cross the street. So from the earliest age, we tell our child, look both ways, hold somebody's hand, don't run in parking lots. We need to have that same attitude of instruction about other things that bother us. For example, our society is getting heavier.
They get fat.
Getting fat. And so as they do, we get more diabetes, more high blood pressure, kidney problems, heart problems. We need, at the earliest age, just as our culture says, look both ways, hold a hand, don't run in the parking lot, we need to say, this is what you eat, this is how you exercise, this is what is healthy for you. We need that culture change in order to have a healthcare change.
Because you can't make them eat right, but you can certainly educate folks about it, and I guess provide the ability for them to comply if they want.
As a teacher, I always think that education is where you begin. And I have patients who have lost a substantial amount of weight. And by their weight loss, they have improved their health. And so these are the folks we need as educators going back to their community, whether it's the guy at Exxon or the folks at the office complex who they have a gym downstairs but no one's been using it, but that one person becomes an evangelist for using the gym. Again, we need this culture change. Again, as an educator, I think that we can do that.
Now, I assume that would go in kind of the second focus. You talked about the healthcare component of your desire or reasons for heading into the race for the Senate. And then there's this educational side. Explain that.
Well, a lot of the stuff that we do, folks wouldn't do if they knew that it was wrong for them. They just don't know. And so it includes the foods that we eat. It includes the lifestyles that we embrace. And I think that if it's been shown, if you show folks how to cook good food but cook it less fattening, they will cook the food that is less fattening.
Now, you talked about educating the residents and how that benefited the healthcare system. What other programs do you envision if you were elected as a senator that would help in that regard?
Well, not just that. One thing I also favor, we need to do something to create economic engines within our society. If we compare ourselves to other communities, we can see that other communities have done a better job of using higher education as an economic engine. You look
kind of like the Pennington.
Well, the Pennington is the example where we've done it right.
Right.
Where private donations took something that wasn't there and made it big. Raleigh-Durham, 40 years ago, was the same size as Baton Rouge. 40 years ago, Raleigh-Durham invested in the Research Triangle, and we did not. Now, 40 years later, their economy is $4.5 billion bigger than ours. Because 40 years ago, someone had a vision about creating research universities with public-private partnerships that would just spin off so that people bought more insurance, bought more cars, paid more taxes for more roads, had jobs building those roads. We need to do that here. Our legislature has never financed higher ed as they should. My idea is higher education tax credits.
Explain that, because and it makes sense what you're talking about. Technology and knowledge has exploded. You can see where the money's going, where
Yes.
the big money's going. How would you fund this?
Yeah, look at what we've done with the movie industry. We didn't have a movie industry 7 or 8 years ago, and now because folks get a tax credit, everyone's invested in the movie industry, and we have an industry $600 to $700 million.
So explain the way that would work.
So the way we do it with higher education is that you decide to contribute something to the law school. You give them $10,000. You get a $7,500 tax credit.
I guess it's state tax credit?
State taxes. And so just like we do with the movie industry, they have to use it for an academic program. Now, the difference between higher education tax credits and movie tax credits is that the movie producer goes back to California to buy her insurance, her groceries, her cars. The LSU professor buys a home in Broadmoor, Sherwood, writes a grant to hire more people who buy a home in Shenandoah. She and they buy their groceries their insurance, their cars in Baton Rouge. The economic impact of this would be far greater than the economic impact of the movie industry.
So it's bringing the folks here. They're attracted by the money and the research facilities, and they stay here, and then they grow their own businesses.
That's what they've done at the Pennington. Private donations created the Pennington, and now we have something which brings in millions of dollars of grants to the economic benefit of our city.
Doctor, thank you so much for coming in. We appreciate it, and good luck.
Thank you.
This is Locke Meredith, the Legal Lines of Dr. Bill Cassidy, running for District 16 to the Senate. Thank you for being with us.